I get fresh ideas for our conference, which takes place in about 7 or 8 months. But I also, I'm still very interested in clinical information, and so a lot of this research contributes to my expertise as an NP and enhances our ability to develop programs and new services for our professional membership, as well as possibly some information for patients who are constantly inquiring about what's new. I actually was thrilled to see there was a nurse session here, part 1 and part 2, which was the first time that ECTRIMS has focused on nursing and nursing research. It's wonderful to view the posters, to see the amount of work going on in research and also clinical care in MS. You know, if we were here 20 or 30 years ago, it might be a lot different because there wasn't an awful lot we could offer. Certainly a lot of the new information about genetics and all the understanding at the bio level. It's not just does a pill work or not, does an injection work or not. It's trying to understand the underlying immunology of the disease or neuroimmunology, as well as potential new agents that could help. And it's a nice message to bring home, to encourage to everyone, because that no one's just sitting on it anymore. Everybody's excited. Nursing in MS care, as you can see, has emerged as an important feature of comprehensive care, and even ECTRIMS, which has been more or less neurology driven, has a very strong bent towards recognizing the enhancing role. I'm not sure how it is in Europe, but in the US and Canada there's a shortage of nurses, and that shortage is going to get worse because of the problems that we face in terms of the workload, which is increasing, and the pay rate, which is not decreasing but certainly not increasing. A number of ways: mentorships, preceptorships. We have on the both Consortium and the IOMSN website accredited information to entice nurses to even be interested in a bit in MS. We have regional programs through the IOMSN, where right now we have a program coming up next week in Vegas. We have 75 nurses sign up. So we're trying to get more interest in the nursing community. Typically the nurse is educated about chronic illness that occurs within a discrete period of time in a hospital or in a home care. And MS, as you know, is not a sprint, it's a marathon. And so you need a very dedicated core of nurses that would be there for the patient during the long haul. We started out with meetings with 100, 150 people who are celebrating our 30th anniversary, the hits on our website, the attendance at our meeting, our submissions to our journals, the special interest groups that have formed focusing on rehab, mental health, professionals in training, and of course our nurses have certainly encouraged me to believe that we're here to stay and we're here to grow, and we're going to certainly be very pleased to collaborate with any organization that will work with us and support us and attend our meetings. And this coming year we have several submissions for our educational programs from Europe. We have a nursing program coming up supported by England, and the faculties from the UK. We have a number of programs from European scientists coming over, Dr. Weissman, a doctor from Denmark, and again, I think we're becoming internationally known for the organization that provides the care. We certainly wouldn't step on the toes of this meeting. There's no way of rivaling it. We are launching our first clinician-driven patient registry. For 30 years we've had a registry called NARCOMS. NARCOMS is a patient-driven registry. Actually, it's 20 years old, and it has over 35,000 people registered. There are a number of new registries out there that are also driven by patients, but in our case, the NARCRIMS registry is going to be clinician-driven, and it'll track patients over time, and we're hoping to have several thousand people enrolled by the end of 2016. We're hoping to link the two eventually, but right now it's going to be clinical data from clinical visits and MRI data, and clinician-driven, as I said. The patients control the NARCOMs with their input every 6 months. We hope to marry the two down the pike. It will benefit because the patients will have access to NARCRIMs, not on anybody else's data, obviously, but how am I doing compared to somebody else? What's the newest in treatments that I might be able to look at? And it's, the new mantra in healthcare now is shared decision making and empowered patient. So all that will add to that opportunity for the patients to become more learned and more self-directed and more powerful in their role. National Harbor, Maryland, actually right outside of DC, is on June 1st through 4th. And we have a very exciting full 4 days. But at the end of June, we have something probably not equally but as exciting on June 23rd and 24th, where we've collaborated with the group that's here, ICOG-MS, International Cognition Society and Multiple Sclerosis, and we'll be holding the first in the U.S., but the 4th meeting of that organization looking at cognitive issues, cognitive breakthroughs in MS at the New York Academy of Sciences.